Hi, my name is Keyshawn Goldmus, and I'm presenting today on the subject of utilization review. Utilization review is a clinical review of appropriateness of admission and planned use of resources. It involves a process of comparing pre-established criteria against the healthcare services to be provided to determine if it is necessary. An important role in utilization review is that of case management. Case management is an ongoing review of patient care in various healthcare settings to assure the medical necessity of the encounter and the appropriateness of the clinical services provided. Case managers are responsible for managing the review process and coordinating the patient's care with physicians, nurses, and other allied health professionals, including social workers and clerical assistants. While utilization management is coordinated by case managers, it is a physician-centered function. Utilization review focuses on using resources wisely. The focus rests on medical necessity and appropriate management of healthcare resources. Its approach involves comparing patient data against pre-established criteria. The method used include evidence-based guidelines and medical necessity review. The drivers are third-party payers such as insurance companies. There are several steps in the utilization review process. They include pre-admission review, admission review, concurrent review, discharge planning, audits, and other retroactive reviews. Each step plays a role in determining medical necessity. Pre-admission and admission review steps involve case managers using criteria and screening software, and in some cases, they may contact the patient's third-party payer to confirm that the admission is approved. The process begins with the collection of information, including the symptoms, diagnoses, results of any lab tests, and list of required services. The committee then reviews the criteria for the patient's condition. It may compare the patient's medical information to the health plan's medical necessity criteria. The next involves concurrent or continued stay review, which assures that the continued medical necessity and appropriateness of care being delivered to the patient, along with appropriate documentation to support the decisions made concerning necessity and appropriateness. Concurrent review happens during active management of a condition, be it an inpatient or ongoing outpatient care. The focus of concurrent review is to ensure that the patient is getting the right care in a timely and cost-effective way. The process is much like that of pre-certification. After the patient begins a medical treatment, any new treatments found on the insurance company's pre-approval list are submitted to the insurance company for approval. Information on the care the patient received, along with their current clinical status and any progress that he or she has experienced, is collected. Once the insurance company or an independent review organization reviews information, the physician and other providers are notified with the decision. An important part of the concurrent review process or step is the assessment of the patient's need after a hospitalization. So because concurrent review is used to decrease the amount of time the patient spends in the hospital, the first concurrent review often determines a discharge plan. So now with discharge planning basically involves coordinating activities for the patient's release from the healthcare facility, along with the appropriate documentation of the discharge status in the patient's health record. This plan can include transfers to rehabilitation, hospice, or nursing facilities. While discharge plans often change due to complications or abnormal test results, establishing an early time frame for hospitalization is key to keeping health insurance costs down. Finally, the audits and retrospective or other reviews involve case managers working closely with HIM to conduct various audits and reviews for compliance with the work plan of the Office of Inspector General of the Department of Health and Human Services. An example at the facility that I work in would include maybe like the record review process. Now, the retrospective review involves a review of medical records after the patient's medical treatment. For instance, an insurance company can use the results to approve or deny coverage that has already been received, and the information can be used in a review of the insurance company's coverage guidelines and criteria for a particular condition. The insurance company looks through the patient's record for evidence of appropriate low-cost health care. It then compares the patient's records to those of other patients with the same condition. It'll then review and possibly revise its treatment guidelines and criteria to ensure that the provided care is adequate and medically current for the condition. This first type of retrospective review can be conducted by the health insurance company, an independent review organization, or the hospital involved in the treatment. So another function of a retrospective review would be, let's say, for instance, is maybe the approval of treatments that normally require pre-certifications, but were done without approval. This can happen if a patient's unresponsive and has not been able to obtain pre-certification. Emergency services like surgery also may be eligible for this type of review. In reference to insurance providers, the review takes place before any payment is made to the provider or the hospital. Therefore, most providers or hospitals are actively involved in the review process by providing clinical documentation that supports their treatment decisions. Again, my name is Keyshawn Goldmas, and I have been presenting on the subject matter of utilization review. And these are the suggested references to review for additional information.